Hi, I'm Kevin Lobo, President and CEO of Stryker. We help make people better. So we see different healthcare systems around the world. They're all grappling with the same issue of tremendous demand, and how do we rationalize and how do we use our dollars to meet that demand. The ACA, the way things play out, it's going to be interesting to see. It's not a blueprint that's locked solid. So I think it'll change a lot, whether access is open access or closed access over time, how that works. It's going to be fluid. And I think the idea of gaining access for patients and having the uninsured be insured is a positive thing, just philosophically. But how that actually translates is yet to be determined. I think it's a fantastic business to be in. There's still significant scope for innovation. You can see that even though we're growing a little bit slower than we had in the past decade, we're still growing in mid-single-digit levels. There are huge populations that are not being treated today. So the opportunity to gain access internationally, especially in emerging markets, is significant. And so I think it's a great space to be in. I've had the experience in my career to work in chemicals, to work in pharmaceuticals, to work in consumer products. And there's honestly no place I would rather be than in medtech. I attended a Harvard boot camp for new CEOs, which was wonderful. So I got to meet other CEOs, both from medtech as well as outside of medtech, and they had the same challenge. Time management, we all cited that as the #1 issue because you also have to work with a board, which is something none of us had done previously. That was one help. And over time, it's becoming getting more comfortable with investors, knowing where and when to spend my time. It's like every job I've had, and I've had a number over my career, and I've transitioned from industries as well as transitioned from different countries in my experience. So transitioning is something I have a lot of experience with, and over time I'm building up that repertoire, and it's getting a lot more comfortable, I would say, at the end of the first year. So the smartphone is fantastic. I embrace technology. It's a huge advantage to be able to text people, to be able to email people. We even, within Stryker, we have a Stryker Connect, which is kind of like a Facebook, where I post and blog to our employees every week. And that's a great way to get the message out, let them know what I'm thinking. I tell them what I'm doing. So every week I say, last week I was in this country meeting with these employees, or I was with these government officials. And that helps keep the connectivity to our employees. 24,000 employees is hard to keep connected to. And so this Stryker Connect feature that we have is fantastic. And people send me comments. They send each other comments based on what I'm communicating to them. So it's not open architecture. We don't send it outside of Stryker, but it's really beneficial.